The educational landscape has been transformed by the COVID-19 pandemic, which has forced institutions to shift to online classes in place of traditional face-to-face classes. According to Alipio et al. 2020, transitioning to distance learning is the most viable option so far as the world continues to cope with these effects of this infectious and deadly disease. The reopening of schools in accordance with the stages at which the states are under the National Recovery Plan. However, class numbers will be controlled and students will alternate between in-person and online learning. We, the researchers, came up with a study entitled Radiologic Technology Students' Perspective on Implementing Face-to-Face Learning Amidst COVID-19 Pandemic. Qualitative descriptive research to seek and gather an in-depth understanding and perspectives of the students. The objective of the study is to uncover the perspective of the Radiologic Technology students on the implementation of the limited face-to-face learning amidst COVID-19 pandemic. During the collection of data, we decided to pick 5 students per year level with inclusions such as a student of Lorma Colleges and a currently enrolled Radiologic Technology student while using a semi-structured design that consists of an open-ended questionnaire. After collecting such data, it is recorded, rewatched, tabulated, and analyzed for the purpose of interpretations. Based on the results of the study, the team formulated 5 major themes: the edge of limited face-to-face, stumbling block, eclipsing limitations, mental and physical preparation, and physiological and psychological effects. Under edge of limited face-to-face, the upcoming limited face-to-face learning will allow them to gain additional knowledge and skills. The participants believe that the motor skills are what they require now, especially since they have been without proper equipment knowledge for years. Stumbling block, the participants' responses convey their concerns and difficulties that they may face. The main issue for the students will be that the cost of transportation will be expensive for them, particularly those who live far from the facility. In eclipsing limitations, where the participants' responses favor the limited face-to-face setup because the benefits outweigh the disadvantages. Overall, the participants support the upcoming changes in classroom setup once they return to school, even if it's only for selected classes. In mental and physical preparation, the participants discuss their preparation for the upcoming limited face-to-face, such as complete vaccination, securing health cards, and proper hygiene is a must for their physical preparation, and also caring for their health is the #1 priority they have right now. Students were also precautious and more concerned on how they will prepare on socializing and interacting with other people without getting infected by the virus. And lastly, in the theme physiological and psychological effects, the participants' answer are generally physically yes, because they believe they were well prepared to deal with the upcoming face-to-face class. However, some students said that because they have been stuck with the online class, they think that they will face challenges in adjusting to a new everyday routine. The researchers investigated that the students' perspective is heavily influenced by the current situation and coping ability to respond to these situations. This study concludes that the implementation of the face-to-face classes needs a more detailed and more structured plan to address and to have a better perspective on the implementation of the limited face-to-face. As a conclusion, it is important to note that this student's perspective it may affect them, whether in a good or in a bad way. The researchers drawn of the study from the findings brought out the following recommendations. The researchers suggest that this research paper will serve as a guide to the clinical instructors and students for them to prepare and improve the educational plan they have currently for the students who are having their limited face-to-face learning, implement strict adherence to school and pandemic protocols as well as social distancing, bringing of hygiene kits such as alcohol, sanitizers, and masks to lessen the risk of transmission. Also recommends that future researchers who will pursue this study use a quantitative research method to enhance, justify, and lend statistical weight to the data and findings and encourage researchers to broaden the scope of this study to include a larger sample size from several departments. This will reveal whether the students prefer to engage and continue with the limited face-to-face class or not.